Welcome back. We are in conversation with Dr. Ramesh Varier, who is the Chief Medical Officer and Superintendent of the Arya Vaidya Kottakal in Delhi. Dr. Ramesh, how do we recognize that there is ama in me?
Very honestly, a patient himself may not be able to recognize in the initial phases. It can be identified on the later stages only. But what I would like to tell, because I would also like that this conversation should be beneficial for the common people.
Right.
So I will give you certain examples of our day-to-day lifestyles which can be corrected, and changing the lifestyle itself will correct that. Need not take any medicines for that. For example, one thing is that osteoarthritis is very, very common in elderly people.
Absolutely.
Now it starts in early stages also. One simple example is that their body weight itself. See, accumulating the fat internally, that is also a kind of ama, because if you are not taking, I'm trying to explain it in a language which is easily understood by a normal person. Especially in northern Indian Delhi, I have seen that for each and every function, lot of sweets are consumed, lot of fried items are consumed, refined food is more used, and the physical activity is less. So there is no balance between our calorie input and calorie spending. Mm-hmm. This actually accumulates a lot of fat in a normal person. And after the middle age, after the age of 40, 45, slowly the body itself gives us a warning that knee pain, when you start climbing up, climbing down and all, you will have knee pain. But nobody cares about that. They simply take painkillers, or they simply do some simple exercises and go on like that. And one fine morning, when the knee X-ray was taken, it is seen the cartilage is completely worn out and you have to go for a knee replacement. At this stage, they come to avoid operation, they come to Ayurvedic. I am talking about a practical example. This is a kind of lifestyle changes which help in reducing this amavastha of this thing. Ama is a toxin which is a destructive thing for many body tissues. So it is not simply the weight only. Weight also is a factor, but the toxins going inside also is a free radical which helps to deteriorate the cartilage. So if we are careful about this, if the body gives you a warning that yes, you have a pain, immediately you have to
listen to the body.
Listen to the body. Listen to the. We are busy so much with so many other activities. We don't listen to. We should spend some time listening to our body. What is happening? This is one example. So if you right from the beginning itself, if you are planning in such a way, you need not even consult any doctor, even for any Ayurvedic physician or allopathic doctor or any other doctor. You can manage it in one way. I am not telling that everybody, there may be genetic predisposition, so many other factors also, but majority of the cases. Another thing in modern lifestyle is that the erratic way of eating, time also is important. Our body has got a rhythm. We call it a biological rhythm. Suppose you take your food between 1 to 2, generally lunch. The body prepares itself to accept the food because it secretes hydrochloric acid and expect food between that time. But if you are not keeping up a time, sometimes you take 1 o'clock, sometimes you take 3 o'clock, sometimes you 5 o'clock, sometimes lunch you don't take. So what happens? Body also get confused. So the already secreted acids, enzymes and all, it has to neutralize it. Then it somehow neutralizes it. And when the body is not ready to accept the food and digest it, you take a heavy meal.
We have this new concept, in our workplace, which is working lunch. Let us quickly work also and have lunch also, or run a lunch on the move. And I think somewhere we are really going wrong.
Very wrong.
So
very
coming
wrong,
back to
very
breakfast,
wrong.
we
Yes.
all must eat a breakfast.
Must eat breakfast,
Okay.
because especially the dinner, after the dinner, but many people, that is also not good. But in modern lifestyle, I'm not telling that dicto as per we may not be able to do, because different categories of people are there, their working hours are different, shifts are different, but still if you know these principles, because you are not helping your body, you are actually ruining your body, because in the young age nobody is going to realize all these things. Once you pass 40, then the degenerative phase starts.
Suddenly,
At
yes.
that time only all these things precipitate slowly. So what I was trying to explain is that the breakfast, lunch and dinner, these three meals at least we should be careful, because dinner, again, many people are, we have a lot of patients, they take dinner 2 o'clock, 1 o'clock at night and directly go to sleep. Minimum 2 hours, 3 hours gap between dinner and sleep should be there. Then only this food will get digested properly. But we don't care those things. And get up, we don't get up early in the morning, okay, no problem. But sometimes we skip the breakfast. A late eater can skip. But whereas in some cases what happens, they take lunch early. By 7 o'clock they finish their dinner. I'm talking about dinner.
Right.
And then morning they have puja and all, then they take only 12 o'clock. 12 o'clock,
So the
1
gap
o'clock,
is
the
so
gap
big.
is so much.
Okay.
So much. So we are actually disturbing our own body by not listening to the body language. So all these matters, if we are little careful, little kind to our body, a lot of things can be reversed. And same way the abuse by alcohol and smoking also. Many people smoke. So we discussed about the lunch and work. That principle is not in Ayurveda. Ayurveda tells that when you eat dhyan, you just away from, because if you are thinking something and eating, it won't get digested. Your biological rhythm won't work, because your mind is somewhere, you have to attend a meeting, so you won't chew the food and you may swallow it and you may take the wrong combination, because you are not concentrating on this. Because what we eat, because we are what we eat, and the thoughts, what we eat and the thoughts, that is how we, or I am made up. So the thoughts also should be pure, the food also should be pure, and the food should be healthy. So all these are principles very clearly mentioned in Ayurveda.
Okay. In the process of running and earning,
Yes.
these are the basic things we ignore. We ignore ourselves, our food,
Yes.
and also very often our loved ones
Yes,
also.
yes,
And
yes.
this is what we're supposed to be working for.
It is very important. I remember that one of the CEOs of a multinational company once said that actually work is like a rubber ball. If you put it, it
It'll come back
comes
to you.
back. But your friendship and relations like a glass ball. If you drop it, it goes off. So you should have